It is true. There are many more diseases out there which are way more scary. But what, of course, is right now so scary to everybody is the fact that we don't know anything about the virus. We don't know how it will continue to spread. We don't know whether people develop immunity once they had it. We don't know exactly how it transmits. We don't know whether we will have a vaccine in any time soon, whatever, 12 to 18 months. And with such events like the one on the cruise ship or suddenly springing up in Italian towns, that is something which scares people. And this is what's making a response right now also difficult on the personal level. And yes, there are many things we can do individually to help contain this outbreak.
Christian, can we tell at this stage, obviously from what you've said, we're still groping around in the dark a little bit in terms of modeling the virus, but can we make a clear statement that the decline we've seen in new cases reported from China is meaningful, that it tells us something about the arc of infections?
If it continues to decline, then it is indeed meaningful, and we don't want to stretch it too far and cry victory there already. But of course, the strong measures taken by the Chinese authorities seem to be taking effect, and that is good. And with all the cumulative figures we see of now 80,000 cumulative of cases in China, we should not forget there's about 25,000 who have already been released as cured. And who are back into the society with no symptoms anymore. But we also need to follow up these people and see if they can redevelop the disease, if they're now immune, if there's any chance of a relapse or whatever. So yes, the slow bending curve is a good sign. But of course, what we have been warning about or warning against and been worried about was exactly what we see now, that some countries across the world see pockets of this virus popping up. Their everyday life is being disrupted. Other countries or cities or towns are being put under quarantine. Sports events are being put on hold. So the everyday life of people is getting disrupted by something which we don't know yet what it is exactly, and that is scary.
Christian, I want to get to those quarantines because as we weigh up the impact across Europe now with these cases in Italy and lockdown in 10 different parts or 10 different towns, what we've seen from the Singapore case, there's been patients who've been reported to have the virus for about 22 days. So how long should the quarantines take place for?
So in every such scenario with the viruses, we will have outliers. But the general recommendation stays the same, that 14 days is a good time and an efficient time for a quarantine and for monitoring people if there's any development of symptoms. Again, outliers are something we need to look at closely, but that's exactly what they are, outliers.
Quickly, how long should we think about the coronavirus impacting the world at this point? SARS was a year to 18 months type of an event. How long should we think about coronavirus?
Unfortunately, it's way too early to predict that. We wish we would have an answer on that one. Again, the possible vaccine is still on the horizon. The everyday life is being disrupted now. If the curve bending in China keeps continuing, then we still have the virus in other countries now where it also seems to be spreading without a clear link back to China. So no, way too early to say. That's why everybody needs to take their own personal precautions as much as countries need to be ready to respond.
Hi, I'm Joanna Bersecci and thank you for watching. You can check out more of our videos by clicking on the boxes on the screen. And don't forget to subscribe to our channel for more from CNBC International. Thank you for watching.